Okay, good afternoon, everyone, and it's nice to be here, and thank you all for joining. Um, I was asked as a training for new volunteers with sickle cell disease. I thought I'd just go through with you um, sickle cell disease basics, complications, and care, and then we have enough time for questions because it's not a very long presentation. So I'll move forward, slide 2. So sickle cell disease is a lifelong disorder. It is characterized, the hallmark of the disease is recurrent, painful, vaso-occlusive episodes. This involves mainly bone pain. It's unpredictable when this pain happens. And this is one of the things that is probably the most debilitating for many of our patients. This disorder is also associated with organ damage and deterioration over time. For example, kidneys, lungs over time can become dysfunctional and require more support. Lifespan is shortened. When you read when you Google lifespan, it probably says at this point in the 40s, 50s. But as medicine moves on and healthcare improves and with access to more people, this is going to get longer and longer. So sometimes you will come across patients who think that have been told by somebody when they told their parents that they wouldn't live past 25. That's not true. And the expectation is that most of our patients will grow up and normally grow up into adulthood and go into and be able to have families, etc. Some people along the way may have complications that impact their life. They're like any chronic long-term medical condition, this affects the whole family, not just the individual patient. And it affects them emotionally, psychologically. It impacts education and employment for the patient and their families. And what we know as best care, patients are provided in a comprehensive multidisciplinary care clinics, which is what we have in Toronto in pediatrics at Sick Kids, at UHN, in Toronto. And then all of the other bigger centers like London, Mac, Kingston, Ottawa, all have centers of excellence for comprehensive care. Just to digress a little, September is Sickle Cell Month. So in September, there's often lots of activities that you'll be called on to participate in. And June 19th is World Sickle Cell Day. This is a UN-sanctioned World Sickle Cell Day. And on this day, also, there's a lot of activity with SCAGO particularly, and across North America, and many different countries now have picked this up. So how do you get sickle cell disease? You inherit it it's an inherited blood disorder. It's the most common inherited severe blood disorder in Canada. And we know that based on newborn screening in Canada, in Ontario, for example, and in other provinces, we have newborn screens. So right after a baby's born, there's a heel prick, and a series of investigations are done looking at some very rare disorders. Sickle cell disease is one of the commonest that we pick up as a positive test. Both your parents have to be a carrier for sickle cell disease for the child to have sickle cell disease. And there's a 1 in 4 chance of the child having sickle cell disease. But it's pretty random. So every pregnancy carries the same risk. And because you have one child with sickle cell on the first time, the next pregnancy could have another child with sickle cell, or you could have a child with no blood disorder or sickle cell trait, or another child with sickle cell disease. Sickle cell disease is not a Black disease. It's more common. More of our patients of African ancestry have sickle cell disease than any other group, but it's common in Hispanic Canadians from Central and South America. people from the Middle East, South Asia, and and of Mediterranean descent. And in Toronto, we have many mixtures of all of the above. So a patient, you cannot look at a person and say, you have sickle cell disease or you can't have sickle cell disease. Just to talk about traits. As a trait or a carrier, most people are unaware that they are carriers for sickle cell disease. So often in the clinic, when new babies come in, we come talking with the family and they say, oh, none of this runs in our family. For the baby to have it, it is running in the family. And the other thing that's quite amusing at times is that often the fathers say, that doesn't run in my family, it has to be on her side, meaning the mom's side. But the child doesn't have sickle cell disease unless both parents are carriers, or or if one parent has sickle cell disease and another parent has another abnormal hemoglobin, together they have a form of sickle cell disease. So being a carrier doesn't impact life expectancy, and most carriers are not sick and don't need any special medical care. It's not a condition where you're born as a carrier and you develop sickle cell disease. If you're a carrier, you stay a carrier for life. It's in your genes, so that's the way you're going to be. And it's important, if you know that you're a carrier, or you know that anybody in your role as a volunteer comes up to you and talks about them being a carrier for sickle cell disease, and if they're of childbearing age, you should advise them. In talking, you should say, you should know your sickle cell status and know the status of your spouse so that you can make educated choices. None of us will ever say you shouldn't have children together but to be educated and make choices that are good for you and your family. So we should all know our sickle cell status. So sometimes the question, it gets asked, well, I've already had my children and I'm fine. And do I still need to know my status? So if your children should know their status, and if they don't know their status and don't want to know, then you as a person should, as like a potential grandparent now, you should know your status. And if you're positive, then you can let your children know that they should also be tested. And if they're positive, then their spouses should be tested so they can make educated choices. Very rarely, uncommonly, people with sickle cell trait can develop blood in the urine. If that happens, their doctor should investigate them for other causes of blood in the urine, and then and also do it with ultrasounds in the urine. Ultrasounds of the abdomen. You can sometimes see where the blood is coming from, and there's a particular pattern you get when in sickle cell disease and sickle cell carrier state in the kidneys, which might explain the blood in the urine. Otherwise, most people with sickle cell trait have no significant symptoms. At the end, if you have any questions, happy to take as I go along. So as we said, the hallmark of sickle cell disease is bone pain, but that's not the only complication. And what happens is that the red blood cells change. This is a normal healthy red cells in a small blood vessel, and the cells change shape and cause a blockage of a blood vessel, so blood isn't flowing in this direction. So if a vessel, this is drawn quite large, but in tiny blood vessels, several of them being blocked, then oxygen doesn't get through to the tissues. And in any condition where a tissue is or organ is lacking in oxygen, if it's a bone, it can hurt. If it's your heart muscle, it can hurt. So that's when you get a heart attack, not just sickle cell disease, anybody, is because there's an obstruction due to some reason. And then, without any blood coming through, then you feel pain. This is the earliest onset of this condition in terms of bone pain starts at about 5-6 months of age. At birth, we have a lot of protective baby hemoglobin, and around 5-6 months, we start switching over to adult hemoglobin, which in a patient with sickle cell disease is sickle hemoglobin, which can change shape, cause a blockage, and cause problems. So this is a little baby with little chubby hands. You can see the knuckle creases here. On this hand, the knuckle creases are gone and the hands are like little sausages. So very early in life, that's the first feature that parents can get. Parents can notice on their babies. As this illustration from this artist who himself had sickle cell disease, it's excruciating pain, and it varies in frequency. Some people are fortunate not to have very many episodes or any at all, and some people have frequent episodes. And these episodes can require admission for pain management, fluids, etc. And when, of course, if you're having pain and you're going to work or you're going to school, it disrupts school work and just healthy recreational activities because of the pain. So that's the hallmark. There are a number of barriers to effective care. The pain is often undertreated, especially in children. People tend not to think that children are in that much pain, babies, because they may not they can't express themselves sometimes. And it can be undertreated also because people are worried, parents are worried about giving their children strong pain medicine, like opiates. The other term for opiates is narcotics. I don't like that term because that's associated, it has an association with street drug use. So the term we use is opiates, which are very potent pain medicine, and it's what patients with sickle cell disease need at different levels and weaned over time under care of a physician. Often our patients with sickle cell disease, particularly the adults who make a choice to come to the emergency room, they may stay at home for a long time trying to manage the pain and wait a long time before actually going to the emergency room. And by then the pain is so well established and they're in excruciating pain. Sometimes it's fear of side effects of high levels of opiates. So what you would recognize in the news, the opiate crisis, where people take opiates and they find them dead on the street. That's opiates that have been laced with fentanyl, we use fentanyl in hospitals in inappropriate doses and appropriate fentanyl, but on the street, it can be laced with other things and lead to a lot of and lead to death, which is what we see outside. And that's what people hear and are afraid of using pain meds. As a volunteer, you may hear somebody say, I don't give my child this morphine or hydromorphone because I don't want them to become addicted. If opiates are used by adults or children in an appropriate way under the care of a physician, you wouldn't become addicted. So that's one of the myths you may come across as a volunteer, people talking about addiction in opiates. Of course, any drug you can become addicted to if you have major psychological effects and the drug is misused. But in our sickle cell population, it's a minimum number of patients who ever get into that situation. And usually there are other things that lead them down that path, just like anybody else that you see developing an addiction. So this is not something that we worry about in managing our patients with severe pain. The object is to get them free of pain. Sometimes in emergency rooms and in outpatient settings, patients may not be believed as to how much pain they are in. And the reason for that is that if you're a person who has had pain frequently, any of us, if you have a first bad toothache or hip pain or something, any normal, you will show, your face might be grimacing, you might be showing externally, sweating, how much pain you're in and you can't move. If you're a person with sickle cell disease who's had pain ongoing, people learn to cope with pain and maybe having significant amount of pain, but not showing it as somebody observing might expect. So sometimes healthcare staff, if they're not familiar, might not think that the person is in that much pain. So you will hear sometimes about patients going to the emergency room and their complaints about the emergency, what happened in the emergency rooms, and we'll talk about what you do about that. There are other complications, and remember, blood flows everywhere. So if you have red cells that are changing shape and causing obstruction, any organ can be affected. A patient's spleen is an organ in the tummy on the left side of the abdomen, and the spleen gets infarcted or dies over time and gets all shriveled. And you need your spleen for your immune function. And patients without a spleen or who's with sickle cell disease with a spleen that's not functioning well are at high risk for infection, especially in little children with a very high mortality. We offset that mortality by preventive antibiotics, several vaccines additional to the routine care, which we get through the clinic as children and in the adult program. There's a risk for septicemia and meningitis, which is higher than the general population. And that's why preventive antibiotics are prescribed in little children, and vaccinations are recommended strongly for children and adults. If a person ever comes to you and says their child or their themselves, they've had a fever, but they're just going to take some Tylenol and stay at home, you should, this is the one time you should advise them, please go to the emergency department. Usually medical advice, you should refer them to their physician. But if they say, I have a fever, and what do I do? Or I have a fever and I'm just going to take some Tylenol and stay at home and see if it passes, just advise them, please go to the emergency department right away. That is how we keep our patients alive and in good health. Waiting at home with a fever, your Tylenol may take the fever away temporarily, but it doesn't take away the cause of the fever. So the bacteria is in your circulation, sitting and dividing and multiplying and getting stronger and stronger until you become septic. And then sometimes it's too late. So fever, if you ever hear somebody having a fever is serious. We take that as an emergency, you go to the emergency department. The other thing that is common to most patients is anemia. Meaning they have very lower numbers of red cells and lower hemoglobin levels. So they have less oxygen carrying capacity around in their circulation. So they become very tired. And if you are ever as anemic, and it can be quite debilitating and depressing if you're really tired, ongoing tired, and just can't enjoy the life like your peers. So that's one of the things. Your body often gets adjusted to the anemia, but some people have really severely low hemoglobin levels, and they should be the things we can do to help that. Just in children, we get strokes, a higher risk of strokes in children and in adults in their 40s and 50s. Every organ can be affected. The kidneys can be affected in adulthood. Most of the complications are in adulthood, except for strokes. That's more common in children, and then later in adults. People who are pregnant with sickle cell disease, they should be under specialty care because they can have issues for themselves or the baby. We can have patients with hip disease. Sometimes people will get used to having a pain in their hip and just go along life and think, I just have to live with this. If somebody says to you that they're having chronic pain in any part of their body, you should advise them to go and seek medical care. Sometimes people get saddened and just accept things that this is the way it's going to be. Seek medical care and let somebody try to make a difference. Like any chronic illness, emotional aspects play a big role, and that's where Dr. Newton would talk about that in a bit. Depression and anxiety can be high, and people keep things to themselves and may just stay at home and not getting out. You want to encourage people to talk about their depression or anxiety. with friends, with, if somebody comes to you, you're working within, volunteer within SCAGO, you can refer them to the appropriate Dr. Newton for counseling, or ask them to speak with their doctor about, to get help. With chronic illness, it changes, and you miss school, you miss work, and with that comes loss of jobs sometimes, being behind in school and not being able to achieve. But we're very proud in our patient and our grade 12 graduates. In the last several years, we've had more than 80% of our children move on to tertiary education. And that's with a lot of work with our transition navigator, and just pushing kids to let them know that they can do well, even though they have this, what is potentially a debilitating condition. What's this disorder is most difficult for. You can be having a great time and you get hit with a pain crisis. So the unpredictability, it's hard for planning, but we do encourage people to go ahead, live their lives, try to live their lives as best, and then and adjust as things come up, but not to stop living. Newborn screening, we started at the end of 2006. Why would we do newborn screening? Because we want to identify babies early in life and to get them started in comprehensive care. Key thing here is educating the parents. We start them on preventive antibiotics. We make sure their vaccines get started. Early in life, at age 2, we start doing some ultrasounds of the brain, looking at the flow of blood in the vessels of the brain to try and recognize kids that might be at risk for stroke, and to prevent stroke. Kids with sickle cell disease can have strokes. And since we've been doing this ultrasound testing and then putting in preventive measures, we haven't seen any strokes in patients who have followed through with receiving transfusion therapy and having the stroke prevention management done. We develop a relationship with the parents, and they get to know all of us, and we try to build trust so that they can reach out to us for support, and if anything is happening with their child, they come to us early. So comprehensive care, once you have been identified on newborn screening, we see you within 3 months of age, and we start regularly scheduled visits to the clinic, and that continues into adulthood. At 18, patients get transferred to adult care and continue with regular scheduled care. If you know of anybody, you just meet, from time to time, I meet somebody in a social setting who has sickle cell disease or out in the community, has sickle cell disease, not in a comprehensive care clinic, we want to get them into comprehensive care because they will do better overall. In a comprehensive care clinic, we have access to different types of healthcare staff. We do screening investigations and early intervention to prevent complications, or if complications arise, to treat complications early before things get worse. We have access to research studies where they meet, those who meet criteria. And we have a few satellite clinics that we can provide care closer to home, and we can set you up with even somebody if you might get called at SCAGO from somebody who doesn't live in Toronto, and they might not know that in London, Kingston, Ottawa, they can get care. So those that's part of the role for education. And we do what we do now, ongoing training of healthcare staff across Ontario to help with comprehensive care. The Ministry of Health set up these quality standards of care. This is something you should go online and read. You don't have to read, it's quite a big document. You can read as a volunteer, you can read the entire thing, or you can read a summary, which is a 2-page summary of quality standards of care. So you're familiar with this. We encourage our patients to know about the quality standards of care, and because this is telling the patient what they should expect from the healthcare services, and this is what the healthcare services are trying to achieve in managing patients. So this is on the Ministry of Health website. If you Google quality statements to improve care sickle cell disease, you'll find it. There are quality standards for diabetes, for some other disorders. And quality standards are written, and this took a lot of work with some SCAGO involvement and many other people. Quality standards are written whenever there's a condition where there's variation in care across organizations, across emergency rooms, in different cities and so on. So Ontario, this is Ontario-wide, this is what patients should expect, and this is what we as caregivers should expect, should aim to get our patients. Not every center is perfect that can provide everything, but you should be familiar with that and suggest to patients to go and look at that. Just very briefly, the one medication we have, which we strongly recommend for most of our patients, is a medication called hydroxyurea. I'm just showing you this here. This is what blood smears look like with sickle cells when you look under the microscope. So these are these are sickle cells. A person on hydroxyurea for 6 months, you notice you have less variation in shape. And by 12 months, you have none of those cells that are showing as sickle cells. It does reduce sickling, and so will reduce that obstruction, will encourage blood to flow clearly. These are what the capsules look like. And we developed at SickKids a capsule shredder to help for patients who don't have access to, for little children, for compounding. The parents can put this in the capsule shredder and mix with some water, an appropriate dose, and with instructions to give their children. This is the one drug that has made a big difference in many patients across the world, and encourage our young people to participate in sports fully. We have basketball players, we have track and field athletes on hydroxyurea. It has made a significant difference. There are a lot of myths out there about hydroxyurea, and sometimes people have nothing else to do but to go online and blog about make up stories, or if they've had a bad experience, they spread it around. And then patients get fearful of using the medication. If somebody should ask you about hydroxyurea, I would ask you to ask them to speak with their physician. Sometimes they may want to speak with a patient who's on hydroxyurea. That might be able to be facilitated, and hopefully that's a person who is on it, and a positive person with good outcomes and a positive-minded people. If you don't take the medication, it doesn't work. It has to be taken every day. It's not when you have pain you take it. It's being taken every day. And sometimes our patients don't take it every day, and then they say it doesn't work. And people who have been taking hydroxyurea, after a year, they notice a big difference. Growth is better in kids and adults. They have more energy and overall better health. This is just one slide to let you know what is sort of curative therapy, because sometimes patients will ask you. In the pediatric setting, we have bone marrow transplants and gene therapy studies, not gene therapy in routine, but under research protocol. But bone marrow transplant is available in pediatrics and in adults in Canada, just to be aware of that. For a bone marrow transplant, you need to have a matched sibling who's a full donor. Gene therapy, you don't have to have a matched sibling, so that's an advantage. So this is my last slide. Each volunteer will have specific roles as defined by SCAGO. But persons affected by sickle cell disease might bring up an issue to anyone. Example, a medical issue. If somebody says, I'm having severe pain, I'm having chest pain, I'm having severe headache, you tell them, go to the emergency room. You don't give medical advice yourself. You say, go to the emergency room. That's the medical advice you give. If it's something that's non-urgent and they said, I don't, let me think of something. I'm getting more back pain than I used to get, or I'm getting more hip pain than I used to get now when I walk, or more chest pain, or or anything. There's a discoloration in my urine, or smell to my urine, or anything, headaches, more headaches than usual. Ask them to discuss it with their MD. Unfortunately, in Toronto, we don't have about, I heard a figure of 30% people, 6 million people don't have primary care physicians. But but we try to get all of our sick patients with sickle cell disease, or people with sickle cell disease, into comprehensive care. So they should discuss it with their comprehensive care team. And I made a note at the bottom, if you come across somebody in a social setting or wherever, or they call you and they are not part of comprehensive care clinic, we ask you to ask them for permission to give their contact information, a telephone number, name and telephone number to the medical officer in Toronto. That would be me, or SCAGO has contacts across Ontario. We can try to get them into a clinic, which is not difficult once we have a way of reaching of the clinic reaching them. If a patient sometimes has had a bad experience with going to the emergency department or care in any setting, at clinics or anything, and they complain to, there's a SCAGO will have someone assigned to listen to complaints and then act on them, and support you in writing or speaking to the patient experiences or patient relations program at the appropriate hospital. And we encourage this. Sometimes patients are reluctant to make a complaint, but the only way things change is if there's a complaint, if the hospital is aware of a complaint, and that's why there's a patient experiences and patient relations program at every hospital has that. And then I will leave just with a question mark. I don't know if we want to do questions now or at the end of Dr. Newton's presentation.
Thank you so much, Dr. Kirby. If you're staying with us, Dr. Kirby, we can take the questions by the end of the session. That's okay? All right, wonderful, wonderful. Thank you again, Dr. Kirby, for this informative session. Dr. Sandra Newton, now to you, if you are ready. Perfect. Yes, we can see you now.
Great. Thank you very much for having me this afternoon. It's good to spend time with everyone that's taken the time to attend. And thank you, Dr. Kirby, as always, so informative and helpful for me, as someone who thinks they've spent a bit of time learning to understand more about sickle cell. You always share something new. And I get the privilege of following your talk, and focusing maybe on something a little bit different. I am not going to obviously repeat all that Dr. Kirby has shared. She's given us a wonderful overview of the biological things that we need to know about sickle cell, the impact on all aspects of life for the people we hope to serve. I am here really to speak about our impact, our opportunities as people that are serving in community, going out to community health centers. Perhaps you are a part of one on this call, a volunteer interested in advancing understanding and awareness of sickle cell. There could be any number of roles that people on the call hope to take up as part of promoting sickle cell awareness. So really, my hope is just to talk a bit about that work and how we can do that well. So I'm going to just attempt to share my screen. I hope that if there are any volume or other issues, folks will let us know, let me know somehow, and I will share. Can I just double check that that is visible and good for all? Yes, Ali?
Yes, it is. Yes, it is. Thank you so much, Dr. Newton.
No problem. Thank you. So full disclosure, I first saw the phrase making the connection around an infant program, interestingly, in the community. And I think connection's what it's all about. We are here to connect with other people, the public, people at various levels of knowledge and awareness of sickle cell in order to move that awareness along. And it's for a purpose, right? It's about promoting well-being, helping people make informed decisions about their health, helping people plan for their futures, helping improve the circumstances for folks with sickle cell disease wherever they live, work, seek their education. So just thought I would take a few moments to follow Dr. Kirby's address to share a bit about some of those practices. And I will not say that this is the sort of the Bible. I would say that there are likely many on this call that are quite experienced in their work with community and supporting people there. So I hope that you will see in the slides that I share some very familiar ideas. If you're newer to work like this, I'd love to know whether there are new things that you pick up. These are really things that I've noticed have been helpful in the work that we hope to do. And as you can see from this slide, I'm part of the psychosocial program that SCAGO runs, and I've had that privilege for the past couple of years. As a psychologist, my work has been counseling, but there's also been an opportunity to be part of educational initiatives and to do some one-on-one work with folks, but also to work with groups. Typically for me at the Black Creek Community Health Center, which has been a wonderful partner and supporter of the work we do. So really hoping to share some things that I've noticed have been helpful for us as members of SCAGO going out to such centers or to community fairs or what have you to share information. And I hope you'll find some helpful things in there. Hoping at the end, as Dr. Kirby mentioned, if there is a Q&A or a question and answer period, that people will submit their questions and maybe even their best practices. I'm sorry that I can't engage with you more as this is a webinar, but I would love to hear about the experiences those working in community have had and some of their takeaways and tips. I think we can always improve, and that's actually the spirit of this talk. So with that, thinking about what it takes to do this work well. And it turns out, yes, knowledge, awareness of your own about sickle cell is great, but it's much more an attitudinal thing, right? It's where you're starting from, what motivates you. In other words, bringing ourselves to the work we do is essential to do it well. And with that, I thought I would just identify a few things to go through with us today. Identifying your why. If you are a fan of TED Talks like I am, there was a really great one a few years ago in a book of the same name, which is about finding your why. It speaks to your purpose. Why do you do the work you do? You could be spending time devoting your talents to a number of things. Why sickle cell awareness? Why sharing information about health with others that you may not have met before? Why do that? So identifying your reasons why and then returning to that often as a way of keeping your commitment to this work fresh and new, because it does need to be rewarding and interesting for you. It's not always easy work, but it needs to be something that you want to keep doing. So thinking about our purposes and intentions. And then thinking about what we bring to the table as volunteers and others doing work in community. You know, we have a variety of strengths. And so often we come to a new experience thinking, well, I'm going to learn a lot, but you bring a lot as well. So really encouraging folks to take some inventory of the strengths that you exercise in other parts of your life and thinking about how to bring it to work like this. And also thinking about how to meet your wishes to grow in knowledge and experience, which will also support the work that you do. I think another great attitudinal piece is that wish for lifelong learning, or at least to increase your knowledge. So the third point reference is being a knowledge seeker. You know, in order to share information, you have to have the facts. And there are a number of ways it turns out to gather information that you can in turn share with other people that you encounter in the community and in your volunteerism. Understanding your audience is key, and that I hope is self-explanatory, but I'll speak more to that because I think even on the call today, we've got folks representing a number of communities, maybe connected to other community health centers that we're in partnership with. And knowing your audience, your community is key for knowing how to intervene. You know what will work more or less well. Developing habits helpful for community connections just refers to some of the simple things. They may seem simple, but they can be quite impactful when it comes to meeting new people, presenting them with information, listening to their questions. Evaluating impact is really just a reminder that after we do all of the work that we're doing, we need to make sure that we are hitting the targets we hope to, that we are providing the information that communities want, that we are answering the questions and meeting a need. We have to find a way to circle back and make sure that we are doing what we hope to do, or to figure out the shifts we need to make to do that better. So always learning, always improving. And that is just a great sort of stance and attitude, I think, to do this work well. And of course, I hope that there will be some time for your questions at the end, whether for Dr. Kirby's address or anything that I raise in the following few slides. So starting with that, identifying your why. Were we all face to face or what have you? I might ask you this, I would say, but you can think about it quietly, or if there is a chat available to you, thinking about what's motivated you to become interested in supporting sickle cell disease education and awareness. Everyone seems to have a story, right? I think of my own. I remember being a student working at Sick Kids many years ago. I met Dr. Kirby then. I was fortunate to do that, and having the chance to interact with youth and get involved in some of their summer camp activities made the sickle cell experience and the lives of others that I was supporting, it made things more real. It made the work seem more relevant that we were trying to do in terms of advocacy and education and so on. I did a lot of my work with children that were attending elementary and high school. So even thinking about their learning experience, I share that only to say that something brings every one of us to the work that we're doing. And it's really important to think about what that is often, because that motivation tends to drive us during times where it may feel that we're not having the impact, or we're not sure that, this is making change. We do need to know that there is that initial motivator that we can build on time and time again. And with that, how can you return to that why often? What will you need to do to refresh that purpose? Is it engaging with other volunteers and people doing community work? I know that with my visits to the Black Creek Community Health Center and meeting the team there, I noticed how dedicated they were to the folks living in the Jane Finch corridor, and how much they were a face to the community. People knew them, people trusted them, people wanted to engage. And I thought, what a powerful thing that must be to come to your work each day and know that you're not just serving community by providing them with medical or other care, but you're sharing of yourself, and you're making relationships solid. And that is very refreshing and energizing when there are big issues to solve. So thinking about ways to identify and keep your why at the forefront are important, I would say. And then as much as I know that many people, as I say, come to this work, maybe they want to learn more for job experience, or they want to help a family member better, or what have you. Everyone on this call has their own strengths, right? They all have something that they can do really well. Maybe for you, it's actually going up to some folks in a sitting area at a community center and offering them a pamphlet, introducing yourself and saying, hey, have you heard about sickle cell disease? Can I share some information with you? Maybe you're the person that wants to work on the newsletter, and you would rather gather the information, report it, and share it. And you feel like that's the service you can provide. Or maybe you're somebody who likes to speak to big groups of people and be part of an educational initiative that reaches many more folks. Everybody's got something that they're comfortable with, do naturally, or are very motivated to grow toward, that they can apply to this work. And so I would say, what are those strengths? And can you bring them very intentionally to the work that you do here? Some of us speak many languages. How can you use that perhaps to engage a newcomer or somebody from your own community to make sure that they understand what sickle cell is and are adequately informed about the next steps relevant for them to maintain good health? For others, as I said, you may have talents in public speaking or any number of other things. All of that matters and counts and is needed here. And then it's always about thinking about how to apply things that you have, right? So, and that's a great question to bring to our volunteer coordinator, to others within the organization. If you're speaking of SCAGO, how can I better highlight the things that I do quite well and want to incorporate more in the work that I do? We do our very best to match people by interest to the needs we have. And sometimes, people help us by just saying, I'd really like to learn more about that. That isn't something I have an opportunity to do much, whether in my working life or otherwise. I like to do it here. So let's always think about leveraging our strengths, because it actually improves the product we offer. And then even if you've done a great job of identifying your strengths and you think that what you're doing when you serve is a good match, how are you going to identify the areas where you hope to grow more? Who will be able to help you, whether it's through some feedback, whether it's through an evaluation process, or maybe it's just a peer-to-peer thing? How can you help each other grow as well? Maybe you set a goal or intention. I really want to make sure that I'm reading, if you're doing a lot in the education realm for sickle cell awareness, I really want to make sure that I read at least one article or something every few months, and maybe someone else can help me to be accountable that way. Or I want to make sure that I take in a webinar. I'm signing up for all of the Learning for Life. These are just different things that you can do, and I think we can help each other to grow as well. But a plan is always helpful. And with that, we are hoping to share knowledge. We need to seek knowledge, right? And we need to understand that learning is not a one-time event. It happens many, many times and in many ways. And within sickle cell awareness, of course, information and education are the products, right? That's what we deliver to folks. And I realize I have a little error there. I'd had information, but education really. Both are our products and what we offer to community. People will look up and Google sickle cell resources that are local to them. And in Ontario, SCAGO has that presence. And we receive many communications, as you might imagine, from all over the province, but also nationally and internationally. So what we have to offer is something highly valued. And as someone who's part of an organization like that, volunteering, you are part of something important and meaningful to folks. So it really behooves us to have a lot of information and education under our belts and to make sure that it's current. It's helpful just to start with what you know right now. Where would you rank yourself? And this is just a conversation you can have privately, with yourself or with a peer. Where is your level of sickle cell awareness and knowledge, and how are you establishing that? Do you feel like sort of comfortable sharing information? Would you know where to point folks if they ask for resources? Have you been able to have a look at available resources, for example, through the SCAGO website? And once you kind of know where you're starting from, how could you increase that level of knowledge? Is there something you can attend educationally? Are there others that you can engage with? What are your intentions to build that? And I think that those habits of building knowledge help us to be helpful sharers of knowledge. I would say that when it comes to sickle cell awareness, it's beyond the biological. I know that Dr. Kirby shared quite a bit about just the genetics. Sickle cell disease is a single gene condition and one of the best known and best understood over many, many decades and more, right? So the genetics is clear. We know how to test and diagnose sickle cell. There are processes and guidelines for that. We can point people in that direction. But did you also know that folks with sickle cell disease deal with a number of complications? We heard a bit about that through Dr. Kirby's talk. This has an impact on function, and not just physical function, not just the pain experience, which is such a hallmark of the condition, but also how someone functions psychologically, how they feel about themselves, how they think, how they process things, how they manage those times where they experience more disability than not as a result of their complications. And did you know that those vary person to person? That sickle cell itself can have a variable presentation person to person. So these are helpful things for us to know as well. There's a social impact, as you might imagine. Sickle cell is something that you have at birth and that is with you for your lifetime, unless there is another intervention that changes that. And bone marrow transplantation is something that sort of fundamentally changes one's sickle cell status to a degree. But for others who are following the typical course, there's a social impact. Children and youth will speak about absences from school, prolonged ones, and work, and the challenges that causes when they want to sort of return and reintegrate with others. It's difficult. You're missing some of the developmental key pieces. You're missing your friends, your peers. You have to explain. These are things that challenge folks with sickle cell. When it comes to finding a partner, people will speak to some of the challenges there. And I think something that we've done to really positive effect at SCAGO is we've looked at the older adult, right? There was a time, as Dr. Kirby mentioned, where folks really focused on the lifespan limitation of sickle cell disease. But with the advent of all manner of treatments, life expectancy is much longer than it's ever been. And so that also means that we are meeting folks that are living longer and experiencing some of those challenges of later life as well as sickle cell. So just having that combined impact. And there are particular needs of all of those lifespan periods that we really do a good job of learning more about if we hope to serve our community. We can meet people at any of those positions, and we can meet people who want to support a family member or friend or loved one who is going through that. So we need to really have that holistic understanding. I put here as well that as much as we understand the challenges of sickle cell disease, we have to understand that folks with sickle cell also bring great resilience to life and living with an unpredictable condition that can cause a lot of disruption. Folks will also say, you know what, I may have these challenges, but I enjoy a good quality of life, or my life has value, and I'm glad I'm here, and I've learned a lot of great ways to cope that I can now share with other people. I think it's actually really great to have folks with sickle cell being a part of the awareness raising, because they can speak to so much and so well to what helps them and what folks need to know. I will say that there's a wonderful online group. It's a WhatsApp chat that the Sickle Cell Awareness Group of Ontario runs, a family chat. I think there's another as well. And I regularly will note that people are sharing strategies to help folks that are going through what they will call a pain crisis or an admission that's not going well, helping each other to advocate for self and others. The community is very powerful. So when you're thinking about sickle cell and some of the challenges, a complete understanding also incorporates the fact that folks are knowledgeable about their condition, are resilient, and have amassed a number of effective ways of coping that they can then pass on to others. So we do well as those who may not have sickle cell disease to learn from them and to be able to pass on that sort of knowledge to other people. I would just add that as knowledge-seeking folks, we want to also understand where to find good quality information. And as it turns out, SCAGO's website and some of the educational programming is really gold. I will say that. There are a lot of archived videos there. You'll find webinars, you'll find articles, newsletters are produced by SCAGO. There are a number of great ways to grow in knowledge and understanding. We also have developed with Karen Fleming, who is also a nurse manager, healthcare practitioner modules. She's also, I should say, an educator. That's been the primary role within SCAGO, and an excellent one. So we have a number of healthcare practitioner modules that have been developed with Karen's oversight, touching on a number of topics. I had the privilege of participating in the one about advocacy. How do we advocate as folks in a hospital or care setting for those with sickle cell? Do we understand the challenges of advocacy, why it's needed, how to do that effectively? Another that I had the chance to participate in was about mental health. And so there are other modules as well that are designed to bring folks who are, whether they are lay people with limited knowledge of sickle cell and indirect in their contact with patients, all the way up to those who are practitioners, specialists, with timely information and approaches to serving people with sickle cell well. These are things that are available to those that have come alongside to do our community work. The more that we understand, the better we can advise and share. I know that Ontario Health came up in Dr. Kirby's talk. She spoke about the quality standard, and that there are a number of them for various health conditions in our province, but one of the newest is the one developed for sickle cell disease. And I also had the privilege of contributing to the psychosocial section of that standard. It is something that I hope folks will research and look up. We can provide those links following this chat or even during, if possible, so that folks can really look through. It's a wonderful tool for patients to have with them. Also great for us to understand what the quality standard is as we are out there promoting awareness. As you might imagine, government websites that are dedicated to health information may cover sickle cell disease, and those are things that are constantly refreshed, edited, reviewed by medical staff to make sure that they're current. I've really just tried, without mentioning particular websites, to just encourage making sure that we are getting good quality information. It's a responsibility in the sharing that we do to pass that on. I don't want to miss that for all of the websites, journals, articles out there. Individuals with sickle cell and those who live with them and care about them, those in the community, are always rich sources of information. They let us know what people know and understand. They let us know what the misunderstanding points are. People that we meet when we're out there in community may help us identify some real gaps in understanding. And so even as we seek to share information, we need to understand where the misunderstandings are as well, so that we can address those effectively, of course, with good quality materials and education. So really just that encouragement then, as we are knowledge seekers, to truly seek it and to seek it from good sources, reliable sources. I think that in order to serve your community well, you need to know who you're serving. And I realize that when you're a volunteer or somebody working in a variety of settings, going out to a health fair, maybe you've been invited to a church and they're saying, you know, we have our reception after service and you can put out your materials and be on hand to answer questions. You may not always know a lot about the community that you are entering just from your own experience. So where possible, the encouragement is to find out more. When I mentioned Black Creek Community Health Center, I know where that's located. I know where its branches are. I know from some of their publications who their audience, or sorry, their community, not their audience, but who their community tends to be, who lives there. What are the demographics of the area? Why is that important for us? Well, as Dr. Kirby also shared, you know, sickle cell disease is not a, quote, Black condition. It is something that appears in a variety of ethnicities and cultural and ethnic backgrounds. However, there are areas in Toronto in particular where we know that high percentages of individuals with Black, identifying as Black and from countries where sickle cell occurs it in high rates, are settled. And we know that those are likely places where folks will have some knowledge of sickle cell and maybe be accessing services, and the needs of that kind of community and the knowledge level may be different in another where that's not the case. So serving our communities is helpful because it also helps us bring the right materials. Do you need the Sickle Cell 101 or do you need something a little more advanced? People from communities familiar with sickle cell disease may want to know where people get care. They may want to know, you know, where do I obtain a certain treatment? Are there trials, clinical trials available? The questions may be different than someone who might want to say, well, what is that? I've never heard of it. And so knowing where we're serving is helpful. And I mentioned here that some communities are online, right? Not everything is in a neighborhood. And people, I would say not to assume or presume a lot of knowledge from some communities, but to go in maybe prepared that you might actually encounter people that are already quite knowledgeable and are now looking for that next level of information. And I really appreciate, and I hope you do as well, that our communities can be diverse, not just racially or ethnically, but linguistically, so many other ways. There are so many intersections, right, that we need to consider. And it's helpful for us just to come in with that awareness and readiness. I think anyone wanting to serve needs to be ready, stay ready. So I mentioned some of the folks that you might encounter that I have in fact encountered when doing some of our outreach work and our awareness in the community. People brand new to sickle cell. So if we are located in a mall, even if it is located in a sort of ethnically diverse, dense area, for lack of a better term, there may be people that are brand new to sickle cell. They've never heard about it, or they've heard something about it, or the question is always, well, why do I need to know? And we need to be ready to answer that question. Newcomers will have needs that may be different from those who have been settled in the area for a long time. They may be familiar with sickle cell from their home or not. They may need materials that are in a different language, or they may need to be pointed to particular resources, maybe physician resources, and of course, community health centers are great at serving the health needs of folks, whether they come insured or not. They may have questions about their status and want some help determining that, just because of risks that they are helped to identify. Individuals with sickle cell, of course, will know what the condition is. They're living with it, but family members may be of varying degrees of knowledge and understanding. One of my privileges is to meet parents and children, school-age children. And parents want to support their child and see them successful, but may not always understand, even if there's more than one child in the same family, the different ways that sickle cell has an impact. And it's not a lack of wanting to understand, it's just that things can vary so much. And sometimes the needs of one child in a family differ greatly from another child in the family, same condition for all intents and purposes. So understanding that family members will have more or less knowledge, siblings are another group, not just caregivers. And individuals with sickle cell, as I said, may be looking for something that step further for their own understanding. We mentioned the healthcare practitioner module a bit earlier. Members of the medical community reach out to us too and seek partnerships. They want to know how to serve patients with sickle cell that may come through their service and that they may not have regular contact with, but really want to learn more about. And it's great for us to be able to set up consultation and things like that. But if they should come to a community fair or encounter you at a health center or in the community, maybe they too are looking for different types of information, whether it's journals or information sources, speakers to invite to speak to their clinical group, what have you. There are a lot of different folks, I hope it's clear from this list, that might be our audience at any point. And the nice thing is that we have a lot of different ways to serve them. Some of it's printed materials, some of it's speaking, some of it's pointing to our website and the resources there, and others just being present in community for some of these invited events. It's really great that folks want us to be part of their events and their success. I mentioned at the top that I was reflecting a bit about, reflecting upon the opportunity to be at Black Creek Community Health Center and some of the other outreach events and places that Sickle Cell Awareness Group of Ontario volunteers and folks like myself find themselves. And I was thinking about other folks that I've had the pleasure of doing this work with and what helped us to be effective, I think. And of course, as others doing community work and volunteering with SCAGO, you may have other perspectives. I really hope that you'll share those with us. It would be wonderful to hear more about what you consider some best practices or go-tos. I just started with knowing our role, and I hope people don't underestimate the importance of sharing information like this in a timely way to folks that need it, and to folks that may not use it day to day, but now have that understanding. Getting rid of falsehoods and misinformation and disinformation. It's a powerful thing to be able to share good quality information with folks, and I hope you know how much your role in doing so is appreciated and valued. I mentioned cultural humility here because I think it's such an important stance. If we're thinking about attitudes and practices that help us do this work well, cultural humility is a phrase you'll hear more and more. There used to be talk of cultural competence. Maybe some of you on the call have heard about that, but I think that that's really gone away. At least it's seen as an earlier point in a process that ultimately ends at cultural humility. And I will just share a quote with you from University of Oregon. There are many that have quotes on what cultural humility is. It involves an ongoing process of self-exploration and self-critique combined with willingness to learn from others. It means entering a relationship with another person with the intention of honoring their beliefs, customs, and values. So I hope you hear in that quote just the stance one takes as a learner, as someone who can learn and be taught things, and who, in wanting to serve, understands that that person has much to teach us about how they want to be served. I know that sometimes we go with our pamphlets and we're ready to ask me a question. I'm ready. I've studied up. I've done all that stuff. And maybe someone simply wants us to listen in that encounter, right? And maybe someone wants to tell us about what it's like to be a member of their community, racially, ethnically, what have you, and wants us to take that in. And maybe it's not always about pouring into people. Often it's about being a receiver, a willing receiver of what they have to share with us. And that just improves what we do. So I like this idea of having cultural humility as a centerpiece, as well as valuing what we give, valuing what we learn and receive. I don't think I need to remind anyone on this call of the importance of confidentiality. There's a lot being shared, and sometimes folks do want to share their story with us. They want to give us a lot of details that are, close to their hearts, that would be identifying, that might make them vulnerable. That can happen when you're talking about something like a health condition. So we must always be thinking about safety and the setting, creating that environment of safety and handling the information we have in a way that safeguards it and the people that are involved. All of us, if we've done any sort of volunteerism or work for Sickle Cell Awareness Group of Ontario in particular, will have signed and read through an agreement about how we handle and protect information. So definitely a best practice, understanding what might be great to talk about in a public setting as people walk through a health fair, and what might be important to take aside to speak privately or follow up with later. I think that that's really helpful for folks. I mentioned here that in order to engage, we've got to be friendly, right? I've put greet all that you need. I liked that it rhymed, but I think it's a handy sort of tool, right? We want to be people that are approachable. We want to be visible. So maybe we're at a table sometimes, but maybe we're also milling through and meeting people that way. Ms. Lanray, who's our CEO at SCAGO, talks about her early work in malls, right? Walking through and meeting people that way. We have to be visible. We have to be on site. We need to be proactive. People won't always come to us. So can we be proactive in going to them and saying yes to those invitations by others in the community to share? So wanted to remind folks to be meetable, right? And whatever that takes. And that doesn't mean that if you're shy or a little more reserved that you don't still have much to offer. It's more just about being approachable. I think that we are more confident in our sharing if we feel grounded in information. We feel like we're solid on some things. And as I mentioned, there are a lot of ways within SCAGO to learn more about sickle cell disease and to keep learning about it. So that commitment to growing in knowledge and skills is huge. Understanding that every encounter we have is going to teach us about something we need to look up and learn more about. We just have to be willing to share what we've got, to say, I'm actually not sure, but I would really love to find that out for you and get back to you, and then doing that, right? There are lots of ways for us to serve. We don't have to know everything. We need to know how to get information and how to get it to people. And we do have some wonderful brochures at SCAGO on a variety of topics, from, having a child with sickle cell, having the sickle cell trait, which Dr. Kirby shared with us about, that single gene, and talking about newborn screening, talking about even things as intersected as the COVID vaccine and what the role of vaccination in sickle cell. And we did quite a lot of work recently on that. You'll be seeing those materials around. Sometimes people just want general info, and sometimes they want something more specific. As I mentioned here, sometimes people are wondering, well, where can I find a doctor? Where can I get that testing done? And I already know about sickle cell, but my doctor may not know much about it, or doesn't really bring it up with me, or I did this testing now at this community fair. How do I get that to my provider so that they understand how to help me? How about my school? Are there some special accommodations, as we call them, that could be helpful for me or for my child? Yes, right? So the more we know what's available as well, the better we can orient folks to it. I don't want us, in all of the sharing and knowing, of course, that we represent the organizations we're from, to forget that we bring a lot of value just on our own, right? And I talked about the beginning about knowing our why, but you have a story too, right? So what is the thing that brings you to this work? Is that a helpful thing to share when you are getting to know some of the people we will meet in the community? I mentioned to folks sort of my first job, and I mentioned the camp story, and that's one of the things that keeps me coming back. For others, it might be a family member or friend, or for others, it might be, this is something I've wanted to give back for a long time. I didn't know in what guise I was going to do it. This opportunity has come. I just know that I really like people to have understanding of their health and well-being, and I wanted to be a part of that. Or I know people who have benefited from this organization. This is our way of giving back to it. Bring your story with you. Again, you knowing why you're there, what you have to offer, who you're serving can only make for a more positive encounter. And then I just mentioned, we want to be reflective. We want to go out there and do our work, but we also want to think about how to do that better each time. So it's a bit of a quality improvement thing. And maybe that's a personal conversation with yourself. Wow, I really want to make sure that I mention this next time. Maybe I need to make a little script for myself so that I won't have to come up with it anew each time. Maybe I want to be able to mention some key things every time I speak with folks. Maybe that would help me do that more effectively, etc. Maybe I want to practice with my partner who's out there in the community with me so we can both improve our delivery. I mentioned that evaluation is also important because we can do a number of things and not always get a good sense after those brief encounters we may have and numerous encounters, how we're doing. And so if there's a way to look at tracking what you distribute, are they certain types of brochures that seem to be disappearing off the table? Are people asking about particular types of information more than others? These are things that help us understand community needs. Data gathering can be a count. How many people did we meet today? What are some of the things you noticed? Were they whole families? Did they seem to be adults, mostly youth? And then that helps us figure out how to serve better. So that making it count is about thinking about how well we're reaching the people we want to reach. And there may be a number of ways of doing that. So having gone through those topics, and I thank you all for your attention to this point, I thought that this might be a good time just to thank you for your attention here and to say that I'm happy to take any questions. And maybe Ali, let us know if this is also when Dr. Kirby's questions might come through, but happy to answer.
Yes, absolutely. Dr. Sandra, wow, that was a beautiful talk, very insightful. I will leave it to the participants. If they have any questions, you can either raise your hand or type it in the chat box, or you can simply unmute yourself to share your question to either Dr. Kirby or to Dr. Newton. Anyone has any question? We'll give it one more minute just in case.
Yeah, I didn't see anything in the chat or the Q&A, but I think people were making some comments maybe. Wasn't sure.
No, actually, I was leaving some comments early on, but then they are thanking you now for Dr. Kirby and Dr. Newton for the wonderful presentations you provided to our volunteers. Okay, so I don't think anyone has any question. So I would like to thank you again, Dr. Kirby and Dr. Newton, for beautifully presenting to our volunteers today. I know we both, all of us, will have a lot of opportunities to work together as we are all part of SCAGO. I believe, Dr. Newton, you discussed or you spoke of the healthcare practitioner or provider modules coming off. Yes, Karen is doing a fantastic job there, and the modules will hopefully be launched very soon. So stay tuned to our website, to the social media platforms. Karen and the team is putting a lot of effort there. So thank you again, everyone, for attending today's session. Thank you, Dr. Kirby. Thank you, Dr. Newton. A recording of this session will be found on our SCAGO website. Have a blessed rest of the afternoon, and we speak soon. Bye, everyone.
Bye. Thank you.
Thank you. Bye.